What are the levels of care that an event planner can implement? Because we often hear, I utilize an EMT on site. What's your response?
So I think in society, people generalize that term of EMT, but in fact, there are several levels of pre-hospital provider. So in some areas, you have just first responders, and they typically just drive an ambulance or have very basic first aid skills. They don't carry, equipment with them. And then you have EMT basics. They have basic first aid skills. They're taught also to assist a paramedic and drive an ambulance, but they can't provide any care above first aid. Oftentimes they have an AED or they have access to one that may already be, at a convention center or on property. In some fire departments or EMS agencies, you'll see what's called an EMT intermediate. So typically an EMT intermediate can assist patients with an EpiPen, or in some places start an IV or check a blood sugar, but they can't provide the level of service which is a paramedic. I would recommend having a paramedic at a minimum to have that risk mitigation at your events. Paramedics can administer medication, do advanced saving life procedures, and advanced level cardiac care. So that's really the level of care that you want. They can start IVs and give intravenous medications. They can contact the doctor and give that full assessment needed to further care for that patient.
Medics can do some things nurses can't even do. The thinking skills a medic has to have, because we're used to not having anybody else around, and being in a hospital, having a doctor next to us or a couple other nurses next to us. We're used to being there on our own. So medic for on-site care, that one of the best medical providers you can have, because we're used to being on our own. And if we can't figure it out, we're going to figure a way out. If not, we know exactly where to get you or who to contact. Medical issues, the customer service issues. You can't go wrong with a medic.
Paramedics work with a lot of autonomy on their own. They have that great triage and assessment base, and all of our paramedics have many years of experience. We don't hire brand new paramedics out of school. So they have that knowledge base from their career and experience to take care of really any issue on site.